Dear students, today we are going to topics about the AIDS. In this lecture, we are discussing about what is AIDS, symptoms of AIDS, causes of AIDS, preventions of AIDS, and so on. Thus, first we are discussing about what is AIDS. When we are talking about the AIDS, the first case of AIDS was diagnosed in the year 1981. Some physicians in California and New York came across unusual opportunistic infections among homosexual men. These infections did not respond to medication, therefore, the patient could not live longer and eventually died. These patients did not show usual conditions of illness known to medical science at that time. Thus, it became evident that it was a new illness to be treated. This new disease was named acquired immunodeficiency syndrome, that is AIDS. Acquired means not born with. Immune means body's defense systems. Deficiency means not working properly. And syndrome means a group of signs and symptoms. The word acquired was chosen because the disease was neither genetically determined nor the result of other conditions. In other words, it was acquired during a normal period of life. Several years elapsed between the identification of the virus that caused AIDS and the first report of AIDS cases. So far, in all cases, the development of HIV in human body leading to AIDS has proved to be fatal. In other words, human beings died of AIDS defining illness. Therefore, AIDS is not a single disease. It is a set of diseases that result from the destructions of body's defense systems. This destruction is done by human immunodeficiency virus, that is HIV. HIV is a very small and fragile virus. It is a RNA virus. It cannot survive outside the human body. Therefore, it's, AIDS is not a contagious disease. It cannot be passed from one person to another easily like common cold or flu virus, nor can it pass through ordinary social contacts. HIV is a member of a group of viruses called retroviruses. Retroviruses are simple microscopic organisms dependent on a host for reproduction. These microscopic organisms lack an independent metabolism. Therefore, they cannot grow without energy and nutrients supplied by a host cell. HIV was first described in 1983 in Paris. It has had several names during its short history of less than 2 decades. But HIV has now been accepted internationally. Some people also call it the AIDS virus. When it infects someone, the virus enters the helper T cells of the immune system. In the cells, it destroys genetic material. The damage caused is permanent. All body fluids contain helper T cells. The concentration of HIV, therefore, is high in blood, semen, and vaginal secretion. An HIV infected person may continue to live a perfectly normal life without showing any physical symptoms. Such a situation is called HIV non-symptomatic. Once the disease progresses, the person will begin to have different illness. He or she may also show certain physical symptoms. The situation is called HIV symptomatic. The term AIDS is used when the disease has progressed and the person develops one or more serious infections or conditions. That is, HIV testing and counseling services are a gateway to HIV prevention, care and treatment. The benefits of the knowledge of HIV status includes the following. First, at the individual level, at the community level, and third one is at the population level. At the individual level, it enhanced ability to reduce the risk of acquiring or transmitting HIV, access to HIV care, treatment and support, and protection of unborn infants. At the community level, a wider knowledge of HIV status and its links to interventions can lead to a reductions in denial, stigma, and discrimination and to collective responsibility and access. At the population level, knowledge of HIV epidemiological trends can influence the policy environment, normalize HIV or AIDS, and reduce stigma and discrimination. In the communities that have been longest and hardest hit by the epidemic, an increasing number of people with HIV are becoming ill and need care, treatment, and support. However, most people with HIV are unaware of their HIV status. Scaling up HIV testing and counseling services is a critical step for scaling up a range of interventions in HIV or AIDS prevention, care, treatment, and support. In September 2003, WHO made a call to action for a target of providing access to ARV treatment for 3 million people in resource-limited settings by 2005 and of working toward universal access. This requires that many more millions of people be tested for HIV and counseled in order to identify those who can benefit from immediate access to treatment and to prevention and support services. Indeed, the increased availability of ARV treatment is likely to generate a dramatically increased demand for HIV testing and counseling. In June 2006, a number of documents relating to the policy and provision of HIV testing and counseling to infants and children were added to the toolkit. They include a selection of documents covering policies, child rights and a strategic framework, child focusing counseling, consent, confidentiality and disclosure, clinical diagnosis and laboratory issues, monitoring and evaluation, and case studies. WHO and UNAIDS released in May 2007 the guidance to provider initiated HIV testing and counseling in health facilities, which articulates recommendations developed over the course of a year-long consultation with many different stakeholders. This guidance, which builds on previous policy positions of both WHO and UNAIDS, encourages healthcare providers to routinely recommend HIV testing and counseling to all persons who present with conditions that suggest underlying HIV infection. HIV or AIDS is one of the most serious diseases. However, since the modes of transmissions are well known, awareness is the best method to reduce the occurrence of this disease. At present, prevention is the only way to handle this crisis, which has become a global menace. What is HIV or AIDS? HIV is a virus which cause impairment to the immune system in the humans. HIV stands for Human Immunodeficiency Virus. This belonging to the family virus called retrovirus. This looks like a sunflower in a full bloom, which is a thousand times smaller than the thickness of hair. AIDS stands for Acquired Immunodeficiency Syndrome. HIV is the virus that causes AIDS. Red field, right hand Tremont explains it as A. Acquired means which is taken from somebody else and there is no genetic inheritance. ID. Immunodeficiency, that is, the immune system becomes so weak and inadequate that the body is unable to fight against the disease. And yes, syndrome, when group of disease or symptoms are present and a person is unable to cope up with it. The HIV attacks our immune system, which is our body's secure force to fight off infections. Once the HIV enters the body, it weakens the body's immune system. HIV mostly infects T cells, also known as CD4 plus cells or T helper cells. These cells are white blood cells and activate the immune system to fight disease. Once inside the cell, HIV starts producing millions of little viruses which eventually kill the cell and then go out to infect other cells. With the breakdown of the immune system of the body becomes susceptible to numerous infections. These are called opportunistic infections because take advantage of the body's weakness defenses. Thus, HIV viruses itself does not cause death. It is the opportunistic infections that cause death. AIDS is the conditions where many opportunistic infections take hold of the body. When the person is infected with HIV, he or she may remain asymptomatic for several years. That is, he or she does not suffer from any illness as a result of lower immunity. It may develop into AIDS after a number of years. People with HIV may not know that they have the virus but can pass on the virus to others. How does it transmit? There are three main modes of transmissions: unprotected sex, blood exposures, and mother to baby transmissions. Unprotected sex it engages in unprotected or unsafe sex, that is, not using condom or any other barrier devices leads to the risk of HIV infections. In fact, heterosexual transmission is the route by which most people with AIDS have become infected with HIV worldwide. A significant portion of HIV infections among women in the world is acquired through heterosexual contact. HIV can be found in the blood, semen, pre-seminal fluid, or vaginal fluid of a person infected with the virus. Blood exposures. Various blood exposures that carry risk of HIV transmissions include injections, intramuscular, subcutaneous, intravenous, blood tests, infusions, dental care, surgery, other medical procedures, tattooing, piercing, shaving, manicures, and pedicures. When cuts occur, and needle stick accidents, sharing of syringes, needles, or injecting equipment carry high risk of HIV infections. HIV can also be transmitted through other body fluids such as semen, vaginal fluid, breast milk, cerebrospinal fluid, which surrounds the brain and the spinal cord, synovial fluid, which surrounds bone joints, and amniotic fluids, which surrounds the fetus. Though HIV is also present in other body fluids such as saliva or sweat, it is present in such low quantities that transmission through these routes is impossible. Thus, HIV is not spread through these body fluids, sweat, tears, and saliva. Mother to baby transmission. HIV can be transmitted through an infected pregnant woman to her baby during pregnancy or delivery, as well as through breastfeeding. Thus, transmission of HIV most often occurs through unprotected sex, through the transfer of contaminated blood from one infected person to another, through infected pregnant women. However, HIV is not transmitted through casual contacts like hugging, kissing, between people with no significant dental problems. Dancing, sharing food or drinking, sharing exercise equipments, using a shower, bath, or bed used by an HIV plus or person insect bites. The counselor must be clear of the fact that no matter how a person became infected, they are facing a serious and life-threatening disease. Therefore, the counselor must have an objective and empathetic attitude towards the HIV affected person. Counselor must take each case separately and must make a comparison for the counseling program to help the patient. Signs and symptoms of HIV or AIDS. Most people with HIV are asymptomatic for 8 to 10 years, although it only takes 3 to 10 weeks for the body to initially respond to infection by the HIV virus by producing antibodies. The progression of HIV in the body is HIV infections. Entry of virus in the body through any of routes. Window period few weeks to few months. Silent infections, no symptoms seen for 5 to 8 years. The window period is a term used to describe the period of time between HIV infections and the production of antibodies. During this time, an antibody test may give a false negative result, which means the test will be negative, even though a person is infected with HIV. To avoid false negative results, antibody tests are recommended 3 months after potential exposure to HIV infections. A negative test at 3 months will almost always mean a person is not infected with HIV. If an individual's test is still negative at 6 months and they have not been at the risk of HIV infection in the meantime, it means they are not infected with HIV. It is very important to note that if a person is infected with HIV, they can still transmit the virus to others during the window period. HIV may lead to AIDS. The symptoms of AIDS vary widely depending on the specific constellation of disease that one develops. Unfortunately, the worldwide prevalence of this deadly disease continues to increasing at an alarming rate, so the counselor must be aware of the following symptoms which can be classified into major and minor. The major symptoms are following: chronic and recurring diarrhea, unexplained low-grade fever more than a month's duration, dry cough, fatigue, progressive dementia, progressive involuntary weight loss of 10% of the known body weight, recurring respiratory infections with poor response to microbial. The minor symptoms are as following: oral thrush, recurring or recurrent or multi-dermatomes, herpes zoster, recurring skin infections, severe seborrheic dermatitis, leukemia. According to NACO guidelines, below is the given of NACO and the National AIDS Control Organization guidelines for case definitions of AIDS in India. Case definitions for AIDS in India was revised in October 1999. The new case definition as follows: the positive test for HIV infections by ERS, ELISA, rapid or simple in children above 18 months and confirmed maternal HIV infections for children less than 18 months. And second one is presence of at least two major or two minor signs in the absence of known cause event suppression. And major signs. First one is chronic diarrhea, intermittent or continuous greater than 1 month duration, and prolonged fever in intermittent or continuous greater than 1 month duration. Minor signs. Repeat common infections, that is otitis, phragmitis, etc. Generalized lymphadenopathy. And third one is oropharyngeal candidiasis. And D, 24th one is persistent cough for more than 1 month. And fifth is disseminated maculopapular dermatosis. And second, case definitions of AIDS in adults. Persons above 12 years of age. Two positive tests for HIV infections by ARS tests and any one of the following criteria: significant weight loss greater than 10% of the body weight within last 1 month, and chronic diarrhea, intermittent or continuously greater than 1 month duration, and prolonged fever, continuously greater than 1 month duration. Tuberculosis, extensive pulmonary disseminated malaria, extrapulmonary tuberculosis, neurological impairment prevailing independent daily activity is not known to be due to the condition unrelated to HIV infection, that is trauma. Candi- Candidiasis of the oesophagus, diagnosable by oral candidiasis with odinophagia. Clinically diagnosed life-threatening or recurrent episodes of the pneumonia with or without etiological confirmation. Kaposia sarcoma and other conditions, cryptococcal meningitis, neurotoxoplasmia, CMV retins, Penicillium marifina, recurrent herpes zoster or multidimensional herpes infections. Thus, we can conclude the symptoms of AIDS and causes of AIDS in this way. AIDS, acquired immunodeficiency syndrome, is the advanced stage of HIV, human immunodeficiency virus infection. It occurs when the immune system is severely damaged and the body can no longer fight off infections and disease. The symptoms of AIDS vary depending on the infections and cancers a person develops. Common symptoms include rapid weight loss. Unexplained or significant weight loss is a common symptom. Recurring fever or profuse night sweats, persistent fevers and night sweats that are not related to other illness. Extreme and unexplained fatigue, chronic fatigue that does not improve with rest. Prolonged swelling of the lymph glands, especially in the armpits, groin, and neck. Diarrhea that lasts for more than a week. Chronic diarrhea without any other identifiable cause. Stores of sores of the mouth, anus, and genitals. Persistent stores or lesions in these areas. Pneumonia. Frequent bouts of pneumonia and other respiratory infections. Red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, indicative of Kaposi sarcoma, a type of cancer often associated with AIDS. Memory loss, depression, and other neurological disorders. Cognitive impairments and mental health issues. And causes of AIDS are: AIDS is caused by the HIV virus, which is transmitted through unprotected sexual contact, including vaginal, anal, and oral sex with an infected person. Sharing needles among drug users through the sharing of contaminated needles. Blood transfusions. Though these rare in countries where blood is screened for HIV. Mother to child transmission during pregnancy, childbirth, or breastfeeding if the mother is HIV positive. Now, why is HIV, yeah, or you can say that AIDS different from other diseases? One of the crucial points that have been made about the HIV and AIDS epidemic is that it is different from most other epidemics and diseases. It requires a much different and broader response, one that goes beyond the health sectors. There are various factors that make it different from other diseases. The find and the foremost factor that is unique about HIV and AIDS from the rest of the other disease. The first and the foremost factor that is unique about HIV and AIDS from the rest of the other diseases is its state or conditions where the immune systems of an individual is totally destroyed. The HIV or AIDS person falls prey to a number of opportunistic infections, especially tuberculosis. This virus is spread through specific risk behavior that is mostly within the realm of private life. This has been discussed in various units provided to you. The most common mode of HIV transmission is unprotected sex and sexual activity with multiple partners. One that is intimate and private. Behavior modification is one of the several ways one can think to reduce the progression of disease in near future. Unlike other diseases, AIDS retains a long period of invisibility, with opportunistic infections appearing years later. It takes between 5 to 10 years or even longer between the initial infections and the onset of clinical symptoms of AIDS. Persons who are infected may have many years of productive normal life. However, the danger is that most people are unaware that they are infected with the virus and can continue to spread it to others. The epidemic's visible and less visible consequences pose an urgent and massive threat to development. Deteriorating child survival, reduced life expectancy, increasing number of orphans, and loss of the most productive sections of working population are some of the commonly seen consequences. Finally, the prognosis for people infected with the virus is bleak. There is neither a vaccine against HIV nor effective medical cure for HIV infections. Treatment options are prohibitively expensive. As of now, HIV and AIDS is essential and incurable and fatal disease. Successful prevention strategies emphasis on behavior modification and healthy lifestyle practices can curtail the spread of HIV or AIDS, and combination drug therapies can delay the progression of the syndrome. Progression of AIDS. Progression of illness depends on the type of the virus, viral load, and general health of the patient. HIV-2 virus has a slow progression. High viral loads are associated with faster progression to AIDS and death. Good general conditions of the patient tends to slow the progression of the disease. Types of progression are typical, rapid, and slow. Typical, the person gets infected with HIV, he survives for a period of 8 to 10 years without any therapy. Sun is asymptomatic for a period of 3 to 5 years and later on develops AIDS. Depending on the type of opportunistic infections, patient may live for 1 to 5 years. Rapid. The patient have a full immunity course. Patient succumb to the disease within 2 years of acquiring the disease. This mode of the disease is commonly seen in persons who have acquired the disease through blood transfusions and slow. A small percentage of patients have a slow progression. They are asymptomatic for a long period of time. Less than 0.5% belong to this group. They have deletions of co-receptors, hence they take a long time to progress. They may survive for more than 20 years. Now, we are going to discuss about the prevention of AIDS. Preventing HIV infection and consequently AIDS involves several strategies. First is safe sex practices, using condoms consistently and correctly during sex and reducing the number of sexual partners. And second one is regular testing, getting tested regularly for HIV, especially if you are at higher risk. And third one is antiretroviral therapy. For HIV positive individuals, antiretroviral therapy can lower viral loads and reduce the risk of transmissions. And pre-exposure prophylaxis, medication taken by HIV negative individuals at high risk to prevent infections. And avoiding needle sharing, using sterilized needles and syringes and participation in needle exchange programs. Blood screening, ensuring blood for transfusions in screen for HIV. Mother to child transmission preventions, HIV positive mothers to take ART during pregnancy, labor, and breastfeeding to reduce the risk of transmissions. AIDS education, meanings, and objectives. AIDS education refers to the dissemination of information and knowledge about HIV or AIDS to the general public and specific at-risk groups. It aims to inform individuals about the nature of the virus, modes of transmission, prevention strategies, and the importance of early detections and treatment. Effective AIDS education combines factual information with efforts to change attitudes and behaviors related to HIV or AIDS. Objectives of the HIV, preventions of HIV, increase awareness, enhance understanding of HIV or AIDS, its transmission, and its impact on individuals and communities. Promote safe practices, encourage behaviors that reduce the risk of HIV infections, such as safe sex practices and not sharing the needles. Reduce stigma and discrimination, addresses and challenge the stigma and discrimination associated with HIV or AIDS to foster a supportive environment for those affected. Encourage testing and treatment. Motivate individuals to get tested for HIV regularly and to seek and adhere to treatment if they are HIV positive. Support affected individuals. Provide information on support services available for people living with HIV or AIDS, including healthcare, counseling, and social support. Empower communities. Engage communities in HIV or AIDS prevention and care efforts, ensuring they have the resources and knowledge to protect themselves and support others. Promote comprehensive sexual education, integrate HIV or AIDS education into broader sexual health education programs to provide a holistic understanding of sexual health and relationships. Effective AIDS education is crucial in combating the spread of HIV and supporting those affected by the virus, ultimately contributing to the global effort to control and eventually eradicate AIDS. Role of different agencies in promoting AIDS awareness education. Local agencies, first one is community health centers, its role and activities. Role. Community health centers provides us accessible and affordable healthcare services, including HIV testing, counseling, and education. They often organize local awareness campaigns, workshops, and support groups to educate the community about HIV and AIDS prevention and treatment. Activities conducting HIV testing drives, distributing educational materials, and hosting information sessions in the schools and community centers. Local and non-profit organizations, its role and activities. These organizations often focus on specific populations at high risk of HIV infections, such as youth, LGBTQ plus individuals, and substance users. They provide targeted education, support services, and education activities, running peer education programs, offering free condoms and clean needles, and providing confidential counseling and support services. National agencies. First one is Centers for Disease Control and Prevention. Its role and activities. Role is the CDC is a leading national public health institute in the United States that works to prevent and control HIV and AIDS through research, education, and policy development. Activities. Developing educational materials and campaigns, conducting epidemiological research, providing funding and guidance for local health departments, and supporting national testing initiatives. A National AIDS Control Organization, its role and activities. The role in India, National AIDS Control Organization oversees the implementation of policies and programs for the prevention and control of HIV and AIDS. It coordinates the national response and works with various stakeholders to promote awareness and provide services and activities, launching nationwide awareness campaigns, distributing free antiretroviral medication, and implementing school-based education programs. International agencies, first one is World Health Organization, its role and activities. Role WHO provides global leadership on public health issues, including HIV or AIDS. It sets international standards, conducts research, and offers technical support to countries in their efforts to combat HIV or AIDS. Activities publishing guidelines on HIV prevention and treatment, coordinating global awareness and campaigns such as World AIDS Day, and supporting capacity building initiatives in healthcare systems worldwide. UNAID, Joint United Nations programs on HIV/AIDS, roles and activities. UNAID coordinates the global response to HIV/AIDS, working to achieve the Sustainable Development Goal of ending the AIDS epidemic by 2030. It brings together the effort of multiple UN agencies and the partners. Activities advocating for policy changes, providing funding and technical assistance to countries, and running the global campaigns to reduce stigma and discrimination associated with HIV or AIDS. Now, we are going to discuss about the diagnosis of HIV or AIDS. HIV test involves detecting antibodies of the virus of the genetic material DNA or RNA or HIV in the blood or other samples. If this is present, the person is called HIV positive. After the original infection, it takes between 2 weeks and 6 months for antibodies to HIV to appear in the blood. The period between becoming infected with HIV and the point at which antibodies to HIV can be detected in the bloods is called the seroconversion or window period. During this period, an HIV-infected person can still spread the disease, even though a test will not detect any antibodies in his or her blood. Several tests can find antibodies or genetic material, that is RNA, to the HIV virus. These tests include first is enzyme linked immunosorbent observant assay, that is ELISA test. This test is usually the first one used to detect infection with HIV. If antibodies to HIV are present positive, the test is usually repeated to confirm the diagnosis. If ELISA is negative, other tests are not usually needed. This test has a low chance of having a false result after the first few weeks that a person is infected. Western blot. This test is more difficult than the ELISA to perform, but it is done to confirm the results of the two positive ELISA tests. Polymerase chain reactions. This test finds either the RNA of the HIV virus or the HIV DNA in white blood cells infected with the virus. PCR testing is not done as frequently as antibody testing because it requires technical skills and expensive equipment. This test may be done in the days or weeks after exposure to the virus. Genetic material may be found even if other tests are negative for the virus. The PCR test is very useful to find very recent infections. Determine if an HIV infection is present when antibody test results were uncertain and screen blood or organs for HIV before donation. Testing is often done at 6 weeks, 3 months, and 6 months after exposure to find out if a person is infected with HIV. Misconceptions about HIV or AIDS. Misconception about AIDS is widespread. A great many people have unrealistic fears that AIDS can be readily transmitted through casual contact with infected person. These people worry unnecessarily about contracting AIDS from a handshake, a sneeze, or from a utensil. Many young heterosexuals who are sexually active with a variety of partners foolishly downplay their risk for HIV, naively assuming that they are safe as long as they avoid IV drugs use and sexual relation with a gay or bisexual male. They generally underestimate the probability that their sexual partners may have previously used IV drugs or unprotected sex with an infected individual. People generally think that AIDS is usually accompanied by discernible symptoms. Their prospective sexual partners who carry HIV virus will carry telltale sign of illness. However, having AIDS and being infected with HIV are not the same thing, and HIV carriers often remain healthy and symptoms free for many years after they are infected. Hence, there is a crucial need to create public awareness and educate them about AIDS. Here, some of myths about the AIDS and the facts are presented. Now, myth. Having HIV means you have AIDS. Facts. Immunodeficiency virus is a virus that destroys the body's CD4 immune cells, which help fight disease. With the right medication, you can have HIV for years and decades without HIV progression to AIDS. AIDS is diagnosed when you have HIV as well as certain opportunistic infection or your CD4 cell counts drop below 200. And myth, HIV AIDS can be acquired through casual contact. Fact, HIV or AIDS cannot be acquired through hugging, using the same towel, or sharing the same glass or utensils. However, the risk of infections comes from having unprotected sex, sharing needles, or getting a tattoo from unsterilized equipment. Next myth, an HIV infected person has just a few years to live. Fact, everyone with HIV experiences it differently. Some people may develop AIDS within a few months as the virus quickly weaknesses their immune system. Many others can live for decades with HIV and have a normal life expectancy. You can help prevent HIV from progressing to AIDS by seeing your doctor regularly and following your doctor's recommendations. Myth. HIV always shows up through its symptoms. Fact, some people don't show any signs of HIV for years after being infected. Many can have some symptoms within 10 days to a few weeks after infections. These first symptoms are similar to the flu and mononucleosis and may include fever, fatigue, rash, and sore throat. They usually disappear after a few weeks, and you may not have symptoms again for several years. The only way to tell you have HIV is to get tested. Myth: HIV can be cured. Fact: there is no cure for HIV, but treatment can keep virus levels low and help maintain the immune system. Some drugs interfere with proteins HIV needs to copy itself. Others block the virus from entering and or inserting its genetic material into immune cells. Your doctor will consider your general health, the health of immune system, and the amount of virus in your body to decide when to start treatment. Myth: HIV cannot affect me and my family. Anyone can get HIV, men, women, and children. Many people are silent carriers of HIV. Even they themselves are unaware of this. HIV gets spread through unsafe sex, infected syringe, and bloods, and from infected mothers. Myth: sex is safe when both partners have HIV. Just because you and your partner both have HIV does not mean should forget about protection when you have sex. Using a condom or other lateral barrier can help protect you from other sexually transmitted disease as well as other strains of HIV, which may be resistant to anti-HIV medication. Even if you are being treated and feel well, you can still infect others. You cannot, next myth, you cannot have a baby if you are HIV positive. Infected mothers can indeed pass HIV to their babies during pregnancy or delivery. However, you can lower the risk by working with your doctor and getting the appropriate care medication. Pregnant women with HIV can take medicines to treat their infections and to protect their babies against the virus. Thus, we can conclude that local agencies such as community health centers and non-profits play a crucial role in the providing direct education and services to at-risk population. National agencies like CDC and NACO develop policies, conduct research, and implement large-scale awareness programs. International agencies, including WHO and UNAIDS, offer global leadership, set standards, and coordinate international efforts to combat HIV or AIDS. Together, these agencies work across different levels to promote comprehensive HIV or AIDS awareness and education, aiming to reduce the incidence of the disease and support those affected. Thank you, students.